And whatever you saw right now, unfortunately, is the harsh reality that prevails in our city. Yes, you heard it right. The Garden City no longer is the Garden City of India. In fact, it is on its way to becoming one of the most polluted cities in the country. As of now, it stands at number 6, and it is already figuring in the top 10. But those days are not really far when we might just topple the others and get to the top, given the kind of construction that is happening in the city, given the kind of pollution that we face on a day-to-day basis. If you also have encountered pollution in your lives, which is pretty common for everyone, at the same time, if you are affected by it, by some way or the other, feel free to give us a call. The numbers will be on display on our screens. Those are the numbers where you can get in touch with us, 080-2236-0304 or 05. Alternatively, text us at 5600-5890. And to discuss this further, we have a panel of guests joining us in our studios. Well, firstly, whoever said that pollution can cause skin problems was mighty wrong, because we have two gorgeous ladies with impeccable skin. Both of them are doctors, just on a lighter note. Nandini Nagar, thank you so much for joining us. She is a neonatologist, which I'm told is a specialization for a pediatrician. Am I correct?
Right, yeah.
All right. On to her left, we have Chaitra Anand, who is a dermatologist. Thank you so much for joining us, Chaitra, in our studios.
Thank you.
And last but not the least, we have Mr. Sadashivaya, who's the chairman of the Pollution Control Board in the city. Firstly, I would like to ask Sadashivaya, sir, what do you think about the real state of affairs as far as pollution in Namma city is concerned?
Well, Bangalore, which was known as a garden city today, is no more like that, because we have too many problems with regard to the pollution. Most important thing is the RSPM, the respirable suspended particulate matter, has gone up considerably.
Considerably, it has almost doubled. In fact,
it has almost doubled.
Significant proportion. 40% is thanks to vehicles.
Yeah.
44%.
Yeah.
44% thanks to vehicles. 14% because of the construction work that is happening. 14% because of the dust flying around.
Yeah.
So technically, if you sum it up, it's about 28%, which could be attributed to the construction work that is happening in the city, because dust flies thanks to the construction that is happening, which it doesn't seem will end in the next 10-15 years, if I'm not wrong. Let's ask the doctors who are joining us in our studios. Obviously, one area of concern because of pollution is kids, because they are the ones who, if exposed to pollution, could be the most affected. Do you have any cases that you have come across wherein kids had breathing problems or asthma or other issues because of pollution?
Of late, I've been coming across a lot more children coming with breathing issues and respiratory infections. There has been a growing number of children coming with particularly these complaints of colds, coughs and fever. See, we have this acute respiratory infection, which we call broadly, and that can be categorized into upper respiratory infection and lower respiratory infection. We have a lot more children as compared to earlier.
The numbers are growing.
Yes, the numbers are growing.
Okay.
And I would say about 70 to 80% of children coming to the outpatient department are with these symptoms nowadays.
That is an incredibly large number. 70 to 80% of children being affected because of the pollution that is there in the city, and most of the cases that you're getting, in fact, are the ones with acute respiratory disorders.
That's right.
What about your patients who come to you? Do you have any such individuals who have skin ailments or issues because of the pollution and the dust that is flying around?
Well, for a long time, doctors, at least dermatologists, know that there's high degree of pollutants, because we get a lot of cases of eczema. It happens in kids, it also happens in adults. And a lot of times kids tend to grow out of eczema, but in Bangalore you'll see a lot of adult population having this, and the reason is because of the high pollution in the air. That's one common. The other thing is psoriasis. There are a lot of patients who suffer from psoriasis who actually get better when they move out of Bangalore. So that's another common ailment that you'll see, and it has to do with, again, pollution being a contributing factor to this. Now coming down to other aspects, you have acne. You see a lot more of acne.
Acne is predominantly because of pollution.
One of the causes, yes.
Okay.
And definitely that it will take a longer time for it to heal. Mostly we used to associate acne with teenagers. So now you'll see that adults are getting acne, and this has to do with pollution.
Right.
Again, with the pollution you're getting a depletion in the ozone. So with that you're getting more exposure to the harmful UV rays, which in turn will lead to skin cancer or skin aging. So it's exacerbating.
And recently there was a survey that was conducted which said that sunscreen actually do not help you as much as they create a problem for you if you apply them.
Well, I think it just depends on how good your sunscreen is. I mean, you can get sunscreens which are just useless, which have a sunscreen labeling, but if you use the right sunscreen,
they can protect you from the UV rays.
They are definitely protective, and you have to use the right amount.
Fair enough. We'll possibly find an answer from the experts who have joined us in our studios. Who are most susceptible to pollution as compared to adults? Do you think it's kids who are in more danger?
Definitely, it's kids who are more susceptible to the air pollution. Now, as early as during the fetal life, the lungs can be affected. The developing lung itself can be affected when exposed to pollution. When the pregnant mother is exposed to pollution, the developing lung itself can be affected. So it can happen as early as that.
And at such an early age, it's also very difficult to treat them properly because they can't really speak like the elders and they can't really describe about the issue.
That's right.
So that is one really great area and one big concern which one needs to address. Just in case you have infants, you have young kids, you got to take double care to make sure that they are not exposed to pollution till there is dust. Well, unfortunately, we do not really have much time in the discussion, so let's concentrate on what we can do to prevent the negative effect of pollution. Let me ask Nandini, what should a parent do to make sure that the child is less exposed to pollution and B, even if he or she is exposed, is less affected?
Well, less exposure to pollution, I think we'll have to leave it to Sadashivaya sir probably. But as far as possible, parents should make sure that at least they can keep their house clean. Environment would include within the house as well as outside. Outside, we would have to depend on the government and policy making and other things. Well, within the house,
but again,
at
if
least
you're going on a two-wheeler and if you have your child, then maybe you can cover your child or probably wear those gloves and all that.
Wear gloves probably to protect the skin. Use a filter if possible. Nowadays, we see more number of people using these filters, which can reduce the amount of particulate matter that they inhale.
Right.
That's one thing. Apart from that, people who are exposed to allergens are also more susceptible to viral infections.
Okay.
So now being the flu season, it's good to actually take the flu vaccine to reduce the incidence of flu, because those who this allergy and infection are sort of interrelated. More allergy, more the infection rate.
Okay.
So it's good to take this flu vaccine also to reduce the incidence of
as a precautionary measure.
As a precautionary measure, because acute respiratory infection includes this flu as well.
Also, the chances of air getting polluted increases during winters. Any specific precaution that you need to take during winters? Because right now we have winter season going on in India and it will go on for the next 2 or 3 months.
Children can be susceptible to viral infections if they are exposed to more cold environment. So using warm clothes and generally avoiding stuff straight from the refrigerator would be good.
Okay. And what about you? Anything that one needs to keep in mind?
I would say that you should use a sunscreen. One is to protect from the UV rays.
A good quality sunscreen.
A good quality sunscreen.
By using vehicles which are very, very old, not getting them serviced properly, throwing away material here and there and so on and so forth. Well, we could have discussed it further, but unfortunately we are pressed for time. Thank you so much, all three of you, for joining us. It was wonderful having you on board. Well, that's all we had over here. As I mentioned earlier, please make sure that you're not contributing from your end. Carpooling is not a bad idea. Please get your car serviced at least once in a while, if not like every month, and so on and so forth, to make sure that we have... Absolutely. Don't burst crackers during Diwali. Well, Diwali is still a long way away, and those who have burst, they've already burst. So possibly next year we'll remind you, but please do your